Welcome to Should Have Known. I'm Venemous, and with me as always is my hetero life mate,
Titan.
On today's episode, we're going to be discussing effects of the pandemic.
Hopefully by sharing these stories, we'll be able to, help people understand how it impacted us and maybe help them, through some of their own feelings and realize that they're not alone.
We would love to interact with you, so please like, subscribe, and leave a comment.
So,
yes, sir.
For you.
For me.
Yeah. So when, shit started going down, right? In 2019?
Yeah,
2019. So, started getting the news about this virus and all this crap, right? Like, what was your thoughts in the beginnings? Say like December. Because I think it was around December is when we started really seeing the news about this virus starting to kind of, make its way and all this stuff. So, like, for you, what was your initial thoughts on all of that? How did you react to that initial news? Were you really worried, concerned?
Yeah, I was definitely concerned. So, and my concern was here's a virus that, yes, right now it's on the other side of the world, but like it could be in the United States within hours. So that was my worry initially when it first hit. There was also, I also remember feeling just kind of not necessarily confused, but more like I didn't know what was really going on. I didn't feel very informed. Because there wasn't a whole lot of information out at the time. So, but my biggest worry was it actually making it over here. And I know that the president got a lot of flack initially when he wanted to close the borders, which, I don't want to necessarily want to get into the political side of this right now, but, I looking back, it probably may have been a pretty good call, right? The things around it, with racism, that's all the negative stuff, right? That's all the bad stuff that I think kind of came out of this whole thing. But at the time, man, it was just really just that feeling of uncertainty. So how did you feel? Like, what was your first, I guess, exposure to it?
Yeah, so we were actually, and I guess, I don't know, maybe I should do this. I should have done this earlier, but before your question, a little disclaimer to everyone. I apologize. I've obviously a little sick. So between my voice and possible coughs, I'll try to, not COVID, just general crud and chest congestion stuff. So,
well, you never sounded sexier, so
apologize.
I like it.
Well, I appreciate that. Going back to your question, I was at my ex-in-laws for Christmas when it was really starting to be big on the news. And I remember thinking, one, I've got to fly home. So there's that, with the family. And so there was concerns regarding that, but yet we had not instigated, any kind of masks or anything at that point. But I remember thinking kind of the same lines as you. It's like, this is going to be here. Like, yeah, maybe, we could have closed the border sooner, but, we've all seen, the movies and stuff, which aren't wrong when it comes to the spread of viruses. It's with international travel, it's instantaneous. I mean, realistically, all it takes is somebody being on that plane, they come into another major airport and boom, if it's airborne, which COVID was, could be spread airborne, then, it's going to spread like wildfire, which it kind of did. But yeah, I think that was for me, it was my initial thing. I wasn't too worried about it because at that time, like you said, we didn't have a lot of information regarding how it really affected us and what was, the death rate like or anything like that. And at the time I'm a fairly healthy individual. Normally, as I just said, I'm sick now. But this is one of those things I get like once a year. I'll get something like this and then I'm not sick for the rest of the year. So immune system wise, I'm usually pretty good. Now, granted, I know with COVID, it was a novel virus. So people had never had it before. So your immune system can't fight it. So anyways, yeah, that's kind of how I was with it. And I don't know. It was interesting, and then it just continued to progress. And I remember starting to watch the charts. Like I got into the analytics stuff and started watching the charts and seeing the numbers, and that's when I started saying, okay, this thing is real as far as it's going to impact us.
Yeah.
So,
Yeah, I remember. So one of my coworkers slash friends, he's got a lot of political connections, and
right.
one of the things that made it real for me is one day he called me and he
Hmm.
said they're gonna call it social distancing, and I
Right.
remember my reaction was like, "What? Like call what? Social distancing? Like what the heck is that?" And then
Yeah.
after that, like we've all heard of social distancing. We all know what that is. So
Right.
that really hit home hard. Also, I remember seeing the news of just the dead. You know, the old folk communities that were just being completely decimated by this thing. Just
Yeah.
before this episode, I decided I'm going to look up some of the statistics around it.
Hmm.
And
Yeah.
53% of people who died from COVID-19 were
Hmm.
75 years old or older.
Right.
53%, which is an insane amount.
Yeah.
Globally, according to the World Health Organization, there have been a total of around 6.8 million people that have died globally. So if you take that 53% figure, which by the way is only for the United States, but if you kind of generalize it across the
Right.
world, like more than half of the people that died across the world were very likely over 75, which is just freaking insane.
Right.
But yeah, man, I remember seeing the news and hearing about these old folks communities just being really severely affected by this thing, and it was super scary. So anyway, so yeah, man, that's kind of the way that I felt initially during the pandemic.
I was gonna say, like we talked about in a previous episode when we were talking about death. Your grandmother, who was at a retirement facility.
Mhm.
She was obviously older, and so did that. Were you thinking about that then in the beginning, in the early stages of this, or was that something that was kind of like later on,
Oh, 100%,
as
man.
far as
Oh,
the
I was
hospitals were
very
getting?
worried about that.
Okay.
Yeah, I was very worried about that because she already had dementia. My grandpa had already
Right.
died, and she was alone,
Right.
and
Yeah.
you have like no control over what goes on there. So I was very, very concerned that she would be caught up in it. Unfortunately, she ended up
Hmm.
passing away during the pandemic,
Right.
which sucks. It was not from COVID, but it was still awful, you know? So,
Right. You know, I think one of the things for me when I remember in the news, as far as COVID, and again, I was like, I'm not that worried about it. I don't really go out that much, or whatever. I think something that kind of sticks with me is, and I know it does with a lot of people, is when Tom Hanks got sick.
oh, yeah.
Which granted
I
he
had forgotten
had
about
no
that. Yeah.
issues from it. Yeah, but I remember when the news hit that Tom Hanks, America's dad, has COVID. I was like, oh my god, like everyone can now get this. Like this is
Yeah.
a real thing. You know. Um, but I remember that thought going through my head at that time. So, you know, I don't know. I think one of the things for me, as the pandemic, really started up, and as we get into it, now we're in February, March, and we start seeing the numbers really going through the roof. We start seeing, the craziness in New York where they're putting people in these trucks because they don't have enough room for their bodies. Um, at that time, were you working from home? Were you working out of an office? And what really, did anything change regarding how, you did your day to day? Like, I guess that's really the question. It's like your day to day, how did it
My
affect
day to
you?
day was not really affected very much because I've
Yeah.
been working from home pre COVID. So
Okay.
the only way that it affected, well, so the way that it did affect my day to day was that we could no longer go on site to visit customers. We could no longer drop in on customers, take them to lunch. So definitely from a
Right.
relationship building perspective, it really did affect my ability and everyone's ability around me to be successful because we're in sales. and sales is a lot
Right.
largely about relationships and relationship building. So that was a negative effect of it. But as far as what I did day to day, it really didn't, because every my commute is like a 5-second commute down the stairs, and that's been the
I
way
got you.
for years. But yeah, just the
Okay.
relationship stuff is what really kind of suffered the most from a work perspective.
Yeah.
You have a different type of job than me, so what was the effect for you?
Well, yeah, I mean, now not in sales, but it's different now. But at that time, I was working for a small manufacturing company. I was just in IT, doing kind of the same thing I do now, just as an employee for the company. And it was interesting to see the politics come into some of the decisions that were made, because you'd have some companies, like a previous company I worked for, just shut the office down. They're like,
Mm,
nope, everybody's working from home.
yeah,
Don't worry about it. You're not allowed in the office, period. Like people had to come back to get stuff from their office. You had to get like permission to get someone to go get whatever it was for you. But the company I worked for was like, well, yeah, we're just going to do 10%. So in the beginning stages, only 10% work from home.
wow,
And so, which for our team, there was only five of us, so I basically met one person per day, and we kind of rotated. And then it eventually got to the point where there was only one person on site. But it wasn't until, and I don't remember the exact month, but it was definitely a couple months down the road. I mean, it was once the county in which the company was in was like, no, everybody shut their stuff down. Essential companies can stay open because of the services they provide to the community in the world or whatever.
right,
And we fell into one of those, which I felt bad because, we had manufacturing people, that worked on the line or whatever. They have to come to work in
yep,
order to work. And, I kind of felt bad because they don't have a choice and they're around these people. And while they did monitoring to see if people were sick and things like that, uh, and from what we know at that facility, we never had any spread to
mm,
anyone. So if someone
that's
did
good,
have COVID at work, they never gave it to someone else at work, as far
yeah,
as we know. So I guess it worked, but it just seemed silly at the time because for me in IT, especially with my actual job role, I can do all of it remotely. I don't have to
right,
be on site. I don't have to see you. I don't have to do anything. I can just do it remotely. Um, but yeah, it was interesting because that company, we had all of a sudden, now everyone needed to be remote, or, eventually 90% needed to be remote. And when they did that, we didn't have enough tokens for people to be able to log in remotely.
hmm,
And then when they did, there was like a limit on the bandwidth and the number of people that could connect remotely. And it was a real issue. So like if I was working remote that day, I'd have to get up at 6 a.m. or 5 a.m. even and connect to the VPN, because by 8 o'clock they would be out of connections. So I would connect at like 6 or 5 and it would stay connected throughout the day and I was fine. But didn't wake up early, you weren't being able to get online and do your job, which was kind of interesting for some of these people. But that was the big thing, I think. Now it's affected me in good ways because I work as a consultant, and customers realized how much money they save by not making consultants travel to be on site every week. Because
hmm,
before, when I was a consultant, Monday through Thursday, traveling, flying on a plane, come back, it was kind of a pain. But now
that's
they're
brutal,
like, oh
man.
man, we save so much money. Yeah, yeah, it is. But they're just like, yeah, you can just stay at home. Um, and now that you're, uh, you know, staying at home, one, they see that they actually get more work out of you, but they also save, like I said, all that money on travel. So
Yeah, yeah.
that part's been good.
So certain jobs really were really heavily impacted by the whole COVID situation. Just like you
Yeah.
pointed out. And I remember, we've all heard about the restaurant workers, and we've all heard about medical
Grocery store workers.
professionals. Yep,
Yeah, yeah, yeah.
grocery store, all those sort of workers were super just. It was really terrible. You
Yeah.
got mom and pop shops that were just super struggling or had to shut down completely. People who lost their entire livelihood. So some people like myself were very, the impact on us was not really all that big, but there's other people that have to
Right.
go into a physical space every single day and just don't have the option to work from home, and stuff like that. So I can see how, some people really struggled really hard. There's some jobs, even with what I do. So I support government agencies. Is really who my customer is, and even they had folks that had to come into the office. So folks that work, for example, in top secret facilities where you have no internet
You
connectivity
have to
in,
be on
right? You
site.
have
Yeah.
to be on
Yep.
site, right? You have to be physically there. So we still
Yeah.
had folks that were our customers that had to support people on site and have the ability to do that. And I remember the whole scramble that you just really did a really nice job of walking through with VPNs, with people that just their VPNs just got overwhelmed, totally congested, by
Yeah.
because they weren't ready for something like this. So I remember when I worked at the bank many years ago, we had actually been ready for a pandemic. We actually did. This was in the mid 2000s. Is around the time range when we were planning for this, because this is where I remember pandemic planning was a big thing at the time, and then all of a sudden it just tapered off. It just disappeared. Like no one cared about pandemic planning anymore.
Right.
But when we did, we did like some really great testing, disaster recovery, all that sort of stuff. So we knew our systems could actually take the load of all of a
Yeah.
sudden the vast majority of the workforce working from home. But a lot of folks were just not ready for that. They just never really imagined that something like that was going to be plausible. So it was just a big struggle. One of my customers had to purchase a lot of hardware to scale out their environment,
Right.
which
Yeah.
delayed things for them, right? And that kind of got them to rethink their their IT strategy. So now you got people who had this digital transformation initiative, and I'm getting kind of geeky here, digital transformation initiative that
Big.
was going to take 5 years or longer, that all of a sudden was shrunk down to, in some cases, days. In some cases, we were able to
Yeah.
help people um, scale up their telework capabilities in a couple of days. But anyway, so this is this is my jam right here, right? Like this is my job. This is my job to talk about work from
Yeah.
home, work flexibility, equity,
Hmm.
right, in the workplace, all that sort of stuff. So this is what I
Well, and
geek
that's
out on
what
every day.
I mean. Well, it's the system help sell was basically to allow people to do that. So
Right.
it makes sense why you'd kind of geek out on it. Um, yeah, and and there's definitely some uh, issues I saw with the company I worked for. We were kind of a subsidiary of a subsidiary kind of thing.
Hmm.
And so there was this overarching parent company that had, you know, hundreds of thousands of employees, and they controlled, while we controlled a lot of our on-site stuff, they controlled a lot of that remote connectivity and IT security stuff. And it really hurt because they were so slow to make decisions. And then the thing we saw, we talk about scaling things up and trying to get the hardware, now we're into July, and that's when we start getting into the chip shortages
Yep.
for a
Yep.
couple of reasons. One is because of the pandemic, but the other is because of Bitcoin and, people doing the crypto mining started hurting hurting getting that. Because I remember later on towards the end of the year in 2020, I was the IT manager. So I'm responsible now for buying hardware and things like that. And I needed to buy laptops. And luckily, I had kind of planned for it ahead of time and started putting in the orders soon enough. But I remember just a few months after I had put in my order, all of a sudden they're like, "Yeah, we don't have any.
Yep.
And you're not going to get one for at least, a year." So, like I said, I got lucky that I ordered them soon enough. But the company I work for now, when I first got hired in early 2022, I got a brand new laptop.
Okay.
And it's funny because
Nice.
even,
Nice.
2
Nice.
years later, yeah, yeah. But it was funny is even 2 years later, I was lucky because most people were getting used ones because they couldn't get new ones still, even 2 years later. So hold on, got a cough. Okay. So how to get that out.
All good.
Um, yeah, and, as we talk about the pandemic, I think, you mentioned not trying to get into the politics of it, but I think we're going to have a hard time not getting into the politics to a certain extent. I'm not going to try to belittle anybody's political thoughts or views, or I'll try not to. I may have a hard time with that. But I think the one thing that COVID showed us is that if it had been worse, I mean, it was bad enough as it is, but if it had been worse with the death rate, it would have wiped us out because we couldn't even agree on wearing masks. Whatever
Yeah.
your thoughts are on it, pro or con, the fact that we couldn't even agree to do that is crazy to me because, and I looked at it as, okay, you don't want to wear a mask. That's fine. That's your view. But the thing is, your mask isn't to protect you. Your mask is to protect other people. So if you didn't want to wear a mask, that means you thought so little of everyone around you. And then you get into the people that would cough on people on purpose because they were wearing a mask. And the other one,
So
it's
crappy,
like,
man.
yeah, like I said, that's the reason I don't think we can talk about COVID and the pandemic without getting into some of that. And I mean, even with the vaccine, I never had a problem with the vaccine. And part of the reason why is because I was military. I was a guinea pig for a couple of vaccines that were not even approved by the FDA. Even then, we were the human trials. And we didn't have a choice. They were like, you're going to get this vaccine for anthrax that's never been tested on humans before, whether you like it or not. So for me, it was kind of like, I've already been in that boat before, so I'm going to take my chances. And I'll say today, again, I'm sick right now, but I've never had COVID. Didn't get it. Neither did my son, who also had the vaccine.
Lucky.
Now I know that the vaccine didn't really stop you from getting it, but it
great.
did seem to reduce the effects of it.
Absolutely.
Because everyone I know who had the vaccine and got COVID had a much less or a much more milder case. It's kind of awkward when you say it like that, but yeah,
it's true.
Yeah. Yeah. So it's my soapbox is the fact that if this had been Ebola and it was airborne, because, currently Ebola isn't, thank God. I think we've all seen the movies like Outbreak and stuff back in the day. But if it was Ebola, it would have wiped out humanity. I mean, we're talking, I think the survival rate of Ebola is like 10%. So that's where we're at with this, is that if this had been worse, it would have wiped everybody out because we couldn't even agree on wearing protective equipment because of the misinformation coming from the various political landscapes. And I just, that's a scary thought to me because luckily this thing wasn't that bad for most people, at least in the U.S. In the U.S., I think our death rate was like 1%. But if you look at the numbers of people who got it, yeah, it have wiped us out.
Yeah, and you don't know what. So one of the scary things is you don't know. You may think that you're relatively healthy, and you very well could be, but what if you have an underlying condition and don't really know that you have an underlying condition? So to
Yeah.
me,
Or,
just the
well,
thought of that was super scary.
when I think one of the things, when they talked about the comorbidities and stuff, at the time, I was heavier. I've lost a significant amount of weight, which I think is probably a topic for another show, maybe. But, that was definitely a thought of mine. It's like, while I have a very good immune system generally, and I don't have any other serious issues health-wise, I was heavy and like very heavy. And, COVID definitely had an impact for people that were. So,
Yeah,
so yeah,
yeah,
no, that was definitely a thought. That was scary too.
yeah. So I caught it back in, when was it?
Yep.
June, July of last year. So here I thought,
Right.
I'm in the clear. Things are awesome. People are getting back
Yep.
together, seeing each other in person. They're doing events, all that sort of stuff. And I go on a work
Yeah.
trip, and those of us who hung out together during the work trip, we all got it. Now for
God.
me, yeah. So for me, I felt pretty crappy for about 3 days or so, and then I felt better, and then I kind of felt for a couple of weeks after that, I didn't feel 100%. I could feel it like in my voice whenever I spoke. You just in my throat. It just wasn't 100%. I wasn't 100% normal for a couple of weeks afterwards.
Just kind of sounded like this. Just all
Yeah,
super sexy.
super sexy, man, super sexy. Let's go get COVID together now. Let's go do it because we want to be sexy.
Oh yeah.
And yeah, so but I was
ahead.
okay, right? Like I don't have long COVID. Nothing like that.
Right. You know, that was another thing to me that was just insane with this whole ordeal was you get sick and the effects that it could have on you long term, which obviously we didn't know a lot of it because it was a brand new virus, but it's like, you know, destroying people's lungs, you know,
Oh
so
yeah.
that you don't breathe right for the rest of your life. You know, that was always
Craziness.
kind of a fear for me. Um, and then, you know, the stuff mentally, like how it can make you, you know, basically cloud your mind, like make it
Right.
hard for you to think straight, which is nuts to think of a respiratory issue that can affect your brain like that. But for a lot of people, they did have that. And even for months, and I think some of them it's long term, like they're not even, they don't know how long it's going to affect some people.
Right. So,
Yeah.
what sort of protocols that you and your family put in place during the pandemic?
Well, first we stopped licking doorknobs and door handles when we'd go into
That's a
places
good
because that
step.
was
Yep.
just an awkward thing. Yeah, yeah, yeah.
I'm sure it
Um,
was really hard for you guys to stop licking
oh man,
doorknobs
I love the taste of
and
a door
toilet seats,
handle in the morning. Yeah, yeah, yeah. Oh, God, the toilet seat's my favorite part. So,
especially when there's something
the
crunchy
big,
on the seat.
yeah. So for me, protocol wise, I guess. So my ex-wife, she had some significant health issues. So
Yeah.
there was definitely concerns about her getting sick. But from a protocol perspective, I mean, I live in a state that you'd almost think COVID didn't come to in some ways, the way they handled the pandemic. But I did all the grocery shopping. So one thing I would do, especially once it really was rampant, was the car side pickup and stuff like that, you know, ordering the groceries like that. Um, I didn't, but I was the person, if I was going into the grocery store, I would go in the grocery store. I would wear a mask. Um, I didn't wear gloves. I think I wore gloves once, kind of early on, but then I was like,
Yeah.
I'm not touching my mouth afterwards. As long as I sanitize my hands, it's fine. We never did the sanitizing of things we bought because I know that was a thing. Like people, especially early on, they're like, we don't know how long it'll live on this stuff. So people, you know, I remember my sister. She said, you know, they would buy groceries and then when they bring it in, they're like wiping everything down afterwards.
My
We never
wife
did
did the
that.
exact same thing,
Um,
dude. The exact same thing.
yeah,
And it drove me crazy.
but yeah, we never did that. We never did that. I just wore a mask and that was pretty much it. And sanitized. Like that was the one thing before COVID. I generally didn't use hand sanitizer.
Hmm.
I'm a firm believer in you need to build up your immune system a little bit, and you need to get stuff in, you know, kind of in you bacteria wise and stuff. And the reason I don't know, I feel that way is because science does prove that you do have to get, you know, some of these illnesses in order to build up your immune system. And I've seen it
So
evident
you
in,
had poopy
you know, you see,
hands.
I washed my hands after I pooped.
Hey, it's not cool to walk around
You
with
know,
fecal matter on your fingers, okay? I'm just
yeah,
saying.
I took a George Carlin method pre-COVID to washing your hands. You know, you wash your hands when you get shit on them. That's kind of how we did it. Um, that was how George Carlin looked at washing hands. But no, I wash my hands after the bathroom and stuff like that always. But
Oh
I
shit.
never use.
Hold on. What the fuck was that? Somebody dropped something upstairs.
That's fine. I'm gonna take a drink.
Sorry. Yeah.
Hold
I
on, I'm
should
gonna
have
take
brought
a
a
drink.
drink. I'm good.
Well,
Kind of. Ooh, I have a drink here. It's been sitting here probably for days. Oh, bottled
hopefully it's not
water.
milk.
Nah, it's bottled
Mm.
water. Oh shit! Just hit
Oh, that's
something.
good then. Um,
Mm. Mm. Ah.
was it good
All
for you?
right.
Because it was good for me.
Oh man, it was so good. All right, so we're talking about poopy hands.
Yeah. So poopy hands. So I washed my hands after I pooped. I just didn't use hand sanitizer a lot. And my ex-wife used it all the time. And she was constantly getting sick, you know, pre-COVID. And so that's, you know, again, I'm kind of a firm believer in like, okay, if you're never putting any of this stuff in your body, you're never going to be able to fight anything off. Um, so I didn't do that. But with COVID, uh, as I leave the grocery store, I would sanitize my hands. I would use the hand sanitizer on the way out that they had usually at the store, which was crazy how quickly those would empty and they wouldn't refill them. Uh, and then I would use hand sanitizer I had in my car, and so that's how I would, you know, use it. But that was the extent of how I handled the pandemic from a protocol perspective.
Yeah.
Coming into the house, I'd already sanitized my hands and stuff, so I wasn't worried about it. I didn't do it again. I wasn't that worried about it. So, how about for you? Like, you talked about your wife. She's sanitizing. The groceries and stuff. What else did you all do?
So we did basically what you guys did. Hand
Yeah,
sanitizer. So we had hand sanitizer. If we didn't have, if she didn't have any hand sanitizer in her purse, like we'd have some in both of the cars. Like always, we always had like
right.
extra masks in both vehicles that we own. Um,
Yep.
I did wear gloves for a really good chunk of time. Just
Yeah.
because sometimes you don't realize how often you touch your face. Like I touch my face a lot. Like
Oh yeah.
I touch my
Yep.
face, like my eyes, the side of my eyes, like the side of my temples, my chin, etc. So I'm a big face toucher, and I know that about myself. So I definitely force myself to wear gloves as long as possible. Um,
So you wore gloves so you could touch your face with the gloves.
yeah, basically.
So with the contaminated gloves, you're touching your
Yes,
face.
100%.
Oh, okay,
No,
cool. Yeah, that makes sense.
after the gloves come off, then I could touch my face.
Well, that's what hand sanitizer was for. Then you can touch your face all you
Yeah,
want.
I'd rather be double careful. So we did that.
Yeah, but you see the logic in that.
Yes, I see the logic
But
in
yeah,
it.
now I get it.
Yeah, well,
Yeah.
whatever. There's no logic sometimes. Okay, all right.
Yeah.
At least I'm not in the camp of you can't
Poopy
make me wear
hands.
a mask.
Oh God.
And then yeah, we would definitely wipe down the groceries, or my wife definitely did. And she did it for way longer than necessary. Way longer, in my
Yeah.
opinion, anyway. Um,
Well.
yeah, so that was kind of what we did COVID protocol wise. Then the other thing for us that was different was, and I know your ex-wife had health issues, was going to the hospital. So my wife, she had to have surgery done
Yeah.
during COVID. So going into the hospital, and going through all that, and the restrictions that they had on visitors was actually
Yep.
pretty tough. Because here your loved one's going in for surgery, and you can't really be there with them. You can't really be there to support them or
Right.
advocate for them. So for me, like something that's huge is being able to advocate for my wife. Um,
Right.
and you can't do that. Now, she can advocate for herself, but it always helps to have somebody else there to advocate for her. So
Yeah.
that was something
You
that
know.
was tough for us.
Yeah. We had my ex-wife had a procedure, and it was something that she'd have like once or twice a year
Hmm.
to help with her migraines. And I remember they basically said no. They postponed all procedures like that unless they were considered medically necessary, kind of a thing. So it got postponed. But I remember when they finally did do it, um, it was like June or July, and it was like an hour drive to drive her there. And when they go to do the procedure, I go to take her in, and they're like, "Oh no, you have to wait in the car." And I'm like,
Yep,
"This is
that's what
going
I
to
had to
take a
do.
couple hours, and it's July, and it's 105 degrees outside. I can't run the car the entire time. You can't go to a Starbucks and chill out because they
Nope.
were all closed, right? You
Yep.
could. There's nowhere to go. So I
Nowhere to go.
basically dropped her off, drove back home. I was home maybe 15, 20 minutes, and then they called me and said, "Oh, she's ready to come be picked up." And it was like, which I mean, it wasn't a huge deal. I guess it's a first world kind of problem, but it was odd that it's like, I can't even sit in the waiting room. But again, I get it. It was just their option was, oh, you can go sit in your car. And it's like, I'll die because it's hot. So that's not really an option. Um, but
Yeah.
yeah, so yeah, I remember that. And there was one time she was actually hospitalized for several days. And I remember going into the hospital, and I was able to stay with her or visit with her and stuff. Obviously, wear a mask or whatever. I typically, when no one else was in the room, would take off my mask because it's just me and her. But coming in and checking in and all the COVID stuff that you had to go through before you could go to her room. So, because she was in intensive care actually for that visit.
Ouch.
So
How
yeah,
how
so
was your son affected?
So our son, that was an interesting thing. I think that's probably a big enough topic for a whole other episode. But
Dude,
we'd
like we
had some
have this
issues.
one topic like spawns
I
so many
know.
different discussions, like mental health, effects on the family,
Yeah.
effect on children,
Yep.
education, right? Like there's
It's
so many
it's crazy,
different
man.
angles. Talk about this, we could talk about the science, and the
Yep.
politicization of all of it and all this sort of stuff. So it's definitely a really huge topic that we're trying to tackle. And I feel
Right.
like we're just skimming through the surface of all those different items. You know what I
Yeah.
mean?
We'll have to dig deeper later.
Yeah.
No, I agree. Um, as far as my son, so in the beginning of the pandemic, he's kind of like me as we're watching the news and stuff, and we'd get angry at some of the politicization. Still don't think I got that right of all this. Like, there shouldn't be politics in this. It should be what's the best thing for all of us together. It comes into Spock said it best, and I'll screw up the quote, so please don't murder me in the comments. But the needs of the many outweigh the needs of the few, something to that effect, or the needs of the one. Anyways, but the point is that it shouldn't be about you. It should be about what's better for everyone together as a society. But
Yeah.
so there was that, but then we had an issue where he was removed from our home for child services. It was a whole thing. It was a big misunderstanding that's no longer a problem. But for 6 to 7 months, he didn't live with us. So here we are in the middle of this pandemic, and he's not even with us. He's staying at a friend's house.
Yeah. To me, that's
Um,
just
so
mind blowing.
yeah, like I said, that's a whole other long conversation. But that made it kind of difficult because it's like, well, how's he doing? Is he getting sick? Because while he was there, he didn't get the vaccine, um, because you know we couldn't make that decision for him, and the person he was staying with wasn't a huge vaccine fan. So there was that.
What about
But I
school?
mean, it is what it is. School was, they went to remote learning.
Yeah.
And I think for him, that's when a lot of his bigger depression issues started to really hit, was because now he's home all the time and he's in his room and he's doing his schoolwork, and, not having that interaction, I think really hurt him from a mental health perspective. For me, working from home, love it. Do it every day. Happy to do it. So it doesn't bother me mentally. Yeah, I like talking to people, but that doesn't really bother me. But like, how did it, because I know you're in a different state, for you and your kids, like how did it really affect them?
Yeah. So mine had to go to remote learning. So I have three kids in completely different stages of their lives. So I had one
Right.
who was at the tail end of high school. He did
Mm,
not get a prom. He did not really get a graduation. So he missed some
yeah.
of the traditions from going to school, which he's never really going to get
Yeah.
back, right? That you never
Right.
make up for
It's
that.
gone.
Then our middle child, her grades suffered. She's
Right.
got ADHD, and so she's got a really difficult time, or ADD, so she's got a very difficult time
Mm,
with paying attention to things that she's not interested in, and just COVID just made learning for her really difficult. Now, when you ask
right.
her, she loved it. She loved not having to get up early to get dressed and go to school
Right.
and deal with people because she's a semi
Right.
introverted. It's funny
Sure.
because she's outgoing and she's got a lot of friends, but at the same time, she
Right.
also has this really introverted side to her. So she loved not having to deal with other kids' BS every single day.
Yeah.
And then our little
Right.
one, like, he was just coming into kindergarten. So imagine your first school experience being during a lockdown.
God,
Yeah. So they
that's
were all
tough.
kind of affected a little differently. Um, Now my eldest, going back to kind of the depression piece of it, he's a very social person. He's generally well
Yeah.
liked by people, and he really did miss the social interaction. And then after he graduated, there wasn't really a whole lot for him to do. So I definitely see, he's definitely been depressed. Now he's going to be going back to school for vocational training in a couple of weeks, and
Yeah.
he's super excited about that because that kind of will help set him up for the rest of his life. But
Yep.
he definitely was one of the people that was definitely affected by depression. I also saw another statistic where they, I guess, polled people. I don't know all the different. I don't know how they came up with the metrics or anything, but according to a study by the World Health Organization, around
Mm-hmm.
25% of individuals
The Who?
were affected. Yep, were affected by the who
It's a joke.
who were
Sorry.
affected by depression, and usually a couple of different factors
Yeah.
came into play. One of them was loneliness, which I think we can all kind of relate
Mm-hmm.
to loneliness, and then just lack of uncertainty and fear of catching COVID, fear of a loved one getting COVID. So lots of different
Right.
factors played into the whole depression aspect. Did you like? I mean, did you happen to have any issues like that too, like with depression or anything like that? Did you ever feel like you were down or kind of stir
Um,
crazy?
no, I think, what's interesting is I think before COVID, I was already in kind of a depression and I had already kind of recognized it and started
Yeah,
taking steps to overcome that. And then, um,
that's a really good
I
point,
don't know,
by the way.
it's funny because I was
Really
already kind
good
of
point.
in depression and I was already doing things to come out of that. I already started therapy and things like that. And I think by the time COVID really started going, we talk about mid to later 2020, um, I was already better in some
Hmm.
ways, or less affected by it and able to manage it. And so I think from a COVID perspective, it didn't. Like I said, for me, working from home, I liked it because I have a lot of downtime in my job in a lot of ways. And if I'm sitting there at the office, you're sitting in the office, like effectively wasting time. But if I have that same downtime and I'm working from home, I can do other things that I need to do on a daily basis, vacuum or clean. And so I took advantage of that to, knock out the things I had been putting off because of my depression.
Right.
So I didn't personally,
Yeah.
but, did you have any issues with any of that?
Yeah. So I definitely felt the loneliness because I was used to being with people. So even though I work from
Yeah.
home, I was used to visiting customers or doing things with
Yeah.
coworkers or partners, going to doing networking events, stuff like that. So when COVID
Right.
happened, it just put a completely like abrupt halt to all of that. And the way that I
Right.
coped, believe it or not, was virtual
Hmm.
reality because I could hop into VR chat and
Right.
interact with other people. So that's the way that I did it. I remember
Right.
just spending many nights just drinking, playing games with people here in VR chat,
Yeah.
watching talent shows because it's something that I still do. And by the way, the day that you did that you went with me to the talent show, it was not
Yeah.
good. It was not good at all.
No.
I went back on it like yesterday or the day before, and they
Yeah.
had some top notch talent there. It was so fucking good. Or
I have to
freaking
give it
good.
another shot.
It was so
I'll give it
good.
another
Yeah.
shot.
It was just that.
Yeah.
And listen, it's like America's Got Talent. You know that 80% of the acts
Yeah.
are not going to be really great. But there's that 20% that just somehow comes out of nowhere,
Make it worth it.
and you're like, oh,
Yeah.
this is really good. Like, why aren't they doing something professionally? So anyway, so I digress a little bit,
Yeah.
but but yeah, so VR chat really became a big, huge thing for me. So that's kind of how I dealt with it, and then trying to we also tried to socialize, be mindful about how we socialize with the extended family too. So we would
Sure.
plan some family gatherings, but we'd be very careful about it. So that also helped being able to stay in touch with them. It was tough though because there were
Yeah.
some patches where we really didn't see our family at all. We talked to them, stayed in touch,
Mhm.
but actually seeing them in person was very rare, and that was really difficult. Not being able to see them.
I think one thing I when you talk about the loneliness, I definitely did feel I miss the BSing with people at work.
Yeah.
Like I said, there was always some downtime, and so you tend to, talk about all kinds of different things. What was the show you watched? Whatever. And I definitely did miss that aspect of it. And so I'd find myself talking on the phone a lot of times with people, maybe more than I had in the past.
Yeah.
But that was probably it for me. I wish at the time I had VR, because to do VR chat, I think like that would have probably been something that would have helped that. Yeah.
Hey, you're doing it now. So that's it for today's episode. Remember, we'll be releasing these episodes bi-weekly to YouTube and as an audio podcast on all podcast platforms. So please make sure you subscribe and check out the links in the description for more content. Titan, what's the topic for our next episode?
So on our next episode, we're going to talk about relationships, kind of give advice for what we think and the experiences we've had within our own personal relationships with our significant others, and maybe just help people see where they can maybe improve their own lives in their own relationships.
Awesome. Sounds great. All right, everybody. Bye for now. Thanks for watching and listening.
Bye.
Bye.
Bye. Bye.